Two years ago, the Ministry of Health announced that it lacked funds for fighting the hepatitis disease. Back then, the ministry's policy statements indicated that the amount of money required to reduce the hepatitis B outbreak in the country was 30 billion shillings. The money was meant to buy drugs and equipment for testing hepatitis. In the budget for the last financial year, 5 billion shillings was earmarked for the cause. But the increase in the allocation hasn't changed much, going by the high prevalence of the disease in parts of the country. Regionally, Karamoja has the highest infection rates at 23.9%, Northern Uganda comes second at 20%, West Nile at 18.5%, and the Western region has the lowest rate at 10%. Hepatitis B is responsible for 80% of all liver cancers in Mulago Hospital. We spoke to a patient who we will call Jacob because he asked us to conceal his identity. Jacob has been living with hepatitis B for a year now. He discovered he had the disease as he went searching for a job.
They gave me the list of diseases that I am supposed to test. And it happened that one of them was hepatitis B. So I went to the hospital. I tested all the diseases I was not having, but they got me with hepatitis B.
Jacob says the results came as a shocker to him because he had no clue about hepatitis B until the medic explained it to him.
They brought back the result. They told me, your result shows that you have hepatitis B. You're hepatitis B positive, but it is non-reactive. I was looking at them, but I could not think of anything. Because first of all, I'm thinking of my life. They used to say the disease is a deadly one. It is hard to treat. Then, secondly, I was losing a job that I know would help me.
Dr. Richard Lukandwa is a consultant physician at Nakasero Hospital in Kampala. He explains what Jacob's results mean.
The hepatitis B is just quiescent in the body. It's not actively replicating or multiplying, and so it doesn't affect your liver, but you just need surveillance over a long period of time.
Dr. Lukandwa says hepatitis B is a viral disease that's highly infectious, much more than HIV. The hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of the virus is 75 days on average, but can vary from 30 to 180 days. The virus may be detected within 30 to 60 days after infection and can persist and develop into chronic hepatitis B. It can also be transmitted sexually.
It may also be spread through from mother to child, which is called vertical transmission.
Whoever is not vaccinated against the disease is at risk of getting infected, but the good news is that the body has a natural way of protecting itself.
Most people are able to fight off the infection using their natural immune system. Unfortunately, a small number are unable to fight off the infection, and so it becomes what we call chronic hepatitis B.
Most people with the disease do not experience any symptoms during the acute infection phase. However, some people have acute illness with symptoms that last several weeks, including yellowing of the skin and eyes or jaundice, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. A small subset of persons with acute hepatitis can develop acute liver failure, which can lead to death.
It affects the liver in a number of ways. It may just cause minimal damage, but in some cases it may cause scarring, and in some cases, if it's very bad, it leads to liver failure.
Apart from taking lifelong medication, the patients also suffer from stigma.
When they heard that I'm hepatitis B positive, almost everyone lost interest. Because being the firstborn in the family, you are the one bringing up the young one, but now they have again got you with a funny disease.
The likelihood that infection becomes chronic depends upon the age at which a person becomes infected. Children less than 6 years of age who become infected with the hepatitis B virus are the most likely to develop chronic infections. It is recommended that one takes his relatives or family members for a checkup after testing positive for hepatitis B. This helps to control and manage the spread amongst other people. Jacob told us how he managed the situation.
I had to tell my wife that I'm hepatitis B positive, because in such a disease, you cannot hide away from your partner. I also had to look for money, then sent her for also testing. She tested, she found she was not having. We tested all the kids, they were not having.
In 2015, the Parliamentary Committee on Health urged Parliament and the Ministry of Health to find funds within the budget to address this concern. Members suggested that unless funds for fighting the hepatitis B virus are made available, the budget for health would not be passed. Consequently, the budget for hepatitis B was increased from 5 to 10 billion shillings for the financial year 2015-16. A complete dose of hepatitis costs up to 200,000 shillings, and this includes checkup and the 3 doses of the drug taken thrice within 6 months. However, Jacob has some reservations about the government's effort in the fight against the viral infection.
If somebody cannot afford to buy what to eat, he cannot also afford to buy what? To buy these expensive drugs. That's why I call upon government to come in place and they help such people.
Viral hepatitis affects up to 400 million people globally. The World Health Organization also estimates that up to 10 million new infections are recorded every year. Here in Uganda, over 3.5 million people live with the disease. According to a 2015 World Health Organization report, 95% of the people who live with this disease do not know they have it. But the good news is, over 90% of the people living with hepatitis C can be cured completely within 3 to 6 months. Don't wait to be a statistic. Go out and have yourself tested for hepatitis. Walter Mwesigye, NTV.